Hola. Hey everybody.
Good evening.
Join us. Grab your cocktails, your tea, whatever you need to get you through this.
Your
Martinis. Slide that martini right over. I love this girl. All right. How's everybody doing tonight out there? Want to remind everybody that we are giving away an area of Xeomin tonight. So once you jump on, we're going to watch how long you follow us, and this really should only be about 30 minutes. Han's gonna go at 30 minutes, and then we'll be signing off. Tonight we are talking about everything. So we want you to interact. I've got my little panel here of millennials. Yay!
Go Millennials!
Go Millennials! I am not one of them, obviously. I'm trying to be, but working on it. So I'm just gonna go ahead and introduce everybody. We'll start on my left here. This is Ashley.
Hello, everyone.
Our laser technician at Renew and medical esthetician and my assistant. She is wonderful.
Thank you, Dr. Barry.
Yeah, and I love the way she talks. So hopefully I can speak as eloquently as her tonight. And then on my right, I'm going to start with Brianna.
Hi,
she is not my daughter. Everybody thinks she is. She's my medical assistant, and she's hopefully going to be going to PA or NP school, and then she's coming back to work with Renew, right?
Mm-hmm.
Yes.
Yes.
And then this is Lisa.
Hi, everyone.
She came to join us from Italy. Yeah. She's my son's girlfriend and a wonderful woman. And so she's here to ask us. She helps us also with advertising, which is why we have 18,000 followers on our Renewed to Cuesta account.
We're doing great.
We are doing awesome.
We're doing amazing, yes.
And then we have Gretchen, who is a aesthetic nurse practitioner, and she's visiting us from Miami.
Hi, guys.
Where we're hoping to open a Renew Miami in the future.
Yes.
So we will keep you posted on that. And she's here to also ask us some questions, and everybody's gonna ask questions and give their feedback. So are we ready?
We're ready.
All right. Fire 'em at me, girls.
Okay, so I have a question, kind of like, where should people start with Botox, or what age would you think people should begin doing treatments like that?
I love that question. So Brianna is asking about what age to start, when you should start. So I didn't introduce myself, but I'm Dr. Barrett. So I love that question because I've been doing this for 22 years, and it's changed a lot. We used to all wait for those lines to come and then run in and have Botox, but I think what I tell people is not an age. I have some, believe it or not, 80-year-olds who really don't have any glabella lines. It's crazy. Wow. And they've never done Botox. So there is not an age. What I tell people to look for is once, everybody's gonna make lines when they smile or frown or raise their eyebrows, they're gonna make lines. What you wanna wait for is when you have a little tiny line at rest. So if you make those lines and they don't go away completely when you relax, then it's time to get on it. And then we're not waiting for those deep lines to occur, and we're gonna be preventative about it. So the whole idea of Botox or Xeomin or Dysport, Jeuveau, the new one, Daxxify, the whole idea with this is to prevent. So, and this is actually where we talk a lot about for you guys' age, is prevention. So no age, obviously I won't treat anybody less than 18, but once you start seeing those little fine lines at rest, then it's time.
Is there a treatment that you can do just one time in one section, or you need to do every 6 months or every year or something like that?
So that's a great question. So typically these, what we'll call neuromodulators or Botox, they last 3 to 6 months.
Okay.
So I do have some rare patients who go a year. So what you're waiting for is once you start seeing that movement coming back, then it's time to come back in. In the beginning, I'll set the appointment at 3 months, just, that way we don't forget about it, because you don't wanna wait till that movement is all completely back. So you can either just come every 3 months and have it done, just to stay up on it and not ever wait for any movement to come back, or you can see when you start moving again and come and get it. So it's almost a personal preference, and I feel like when you're young, you have a little more leeway. Now, if you're somebody that has super deep lines at rest, and there are some young people that have already gotten some super deep lines, I wouldn't wait for the movement to come back. I would just stay right on it, because it takes a while to get rid of those deep lines.
I have a question, Dr. Barrett. How do you feel the young people metabolize the Botox or whatever neuromodulator you're using? Do you feel like it's faster, slower?
I think it depends on the person. The age doesn't seem to matter.
Okay.
I don't find. Now, I tend to find over the years that patients who are more active, like, if they're real thin, super active, work out a lot, exercise a lot, they will metabolize it more. So it really, I don't think, depends on the age as much as the activity, and then some people just genetically just metabolize everything faster, and just like the ones who go a year and they don't really metabolize it at all.
Nice. I like what you said about the scheduling every 3 months with like younger people. It's like don't necessarily wait for the movement to come back, because like I don't want to see movement after I've seen no movement. I don't want to see movement again. So like I like staying on top of it. So it's nice. That's a good idea.
Yeah, I think it's good, and it's personal too. Some people don't ever want any of that movement to come back, and then we're gonna see you every 3 months. But others, and it also depends on budget. Sometimes, they can only come every 6
Right.
months. Well, that's better than never doing it at all, because that repetitive movement's gonna lead to lines in the future. So if you can only do it once a year or twice a year, that's okay, especially when you're younger. But to your point, it's prettier if you just stay on it.
Absolutely.
It's sad when you start to like see your face like start to melt.
That's the one thing I always tell my patients. They're like, is there any like worries about using Botox? And I'm like, yeah, it's addictive.
Only downside.
That's the problem.
I think that there's a common misconception amongst patients who they believe that Botox might make their face look, or a neuromodulator might make their face look fake or different. And I think it's important that you clarify that it is preventative, but could you explain exactly what it does, like how it helps to prevent those lines, and how it might change, if at all, the appearance of the face?
Yeah, so that's a great question. So these work by binding to a receptor and stopping the movement of a muscle. So we inject specifically, looking at the muscles. And I always tell people, look for an injector who's gonna have you do the faces as they're injecting. Because if they're just going and shooting up the muscles in a certain pattern, everybody's muscles are placed differently, move differently, have different bulks. So we're looking at those muscles that create the movement. So here are the 11s everybody talks about. The muscles right here are the ones that we're looking at. And that repetitive movement of those muscles over and over and over again is what causes those lines to be deeper and deeper and deeper. And then they become what we call static lines, which means when you're resting, they're still there. And that's what we want to prevent.
Absolutely.
We do not want that to happen. That's a no-no. So we're going to treat that. We're going to inject those particular muscles with Botox or some other neuromodulator. And then what happens is over the next 2 to 14 days, it's going to kick in, and it's going to relax those muscles so they can't cause those lines anymore. So some people like to be frozen, and some people want to prevent those lines, but they want to have a little bit of animation. And I would say in my practice, probably more people, they tend to be more natural.
Absolutely.
And so they want to be able to raise their eyebrows a little bit. They want to be able to look surprised. You know, I think when my kids were little and I started doing Botox, I said, yeah, mommy will, you know, is really mad at you, but you'll know exactly how mad she is when my Botox wears off. You know, so, you know, you have to, some people like, you know, men, for instance, if they're a lawyer or they're in some kind of position where they have to look angry, they don't want to be frozen there in those muscles. So, you know, it's really a personal preference, but that's the way it works. That's what we're trying to do. So we're trying to prevent lines and wrinkles that are going to down the line need filler or lasers to correct them.
If I had $1 for every patient I spoke with who said, I wish I would have started this sooner, I'd be a very rich woman.
There you go. We should start that. Well, you gotta pay us.
Piggy bank.
Are there any other preventative measures besides Botox people can take when it comes to fine lines forming?
Lots of things. So the simplest one is skincare. Skincare is probably the simplest, easiest one. You know, we don't have to worry about side effects or problems. It's something that a patient can do at home. They can just get their products. They don't have to come in constantly. So that's an easy one and a no-brainer, and everybody should be on good skincare. And it's as simple as a good cleanser. If you have pigment, something that to lighten the pigment. If you're dry, something to hydrate. Some type of retinol or retin-A.
Absolutely.
You know, I always say that's the fountain of youth. So retin-A, a good retinol. I actually started doing this when I think I was 38, and I probably would not have gotten on great skincare if I hadn't gotten into this, but I was able to prevent lines here just with retin-A for a while. So, you know, these, and all these things are complementary. You know, you want to do great skincare. Sunscreen is the
I
bomb.
was waiting for Ashley to say it.
Yes.
Sunscreen.
The first time I met her, I said, what can we talk about, some skincare? And she says, tell me about your sunscreen. And I was like, what about my sunscreen? She's
Leading
like,
question.
absolutely. She's like, well, do you put it on? I said, what's in my makeup? No, that's not good enough. All right, I need some sunscreen.
Most people believe they can rely on it
Yeah.
in their makeup.
Oh yeah,
Yes,
everybody
It's just
does.
not sufficient.
I was like, no, I want a face wash. She's like, let me tell you about
So
sunscreen.
let's start with the basics.
It is the basics, and we do, you know, we don't sell a particular product here. We do renew skin, because I might like this product is the greatest product, and next month another product comes out that's better. I don't want to sell you this brand or that brand, so it's whatever we know works, and it's great. So sunscreen hasn't changed for a while, but everything does, and we have like Renew Skin Acne or Renew Skin Basic, different packages of different skin products. So
Speaking of acne, are there any particular acne treatments that you would recommend or that are your go-to when treating patients with acne or active acne?
So obviously skincare
Mhm.
is number one, so we work on that. And then this kind of goes to your point of things that you can do to prevent too. So when people have active acne, microneedling is the bomb. And you guys have seen it, right? I don't know if you've seen that, Gretchen, but microneedling for active acne almost can tell a patient within 24 to 48 hours your skin's gonna look better. So first we have to get that under control, skincare, microneedling, and now we have exosomes with microneedling. And I know Ashley loves to talk about exosomes.
I love to talk about exosomes. I've seen them work their magic with our patients, and I think that they are not just effective, but they're exciting and they're new. So many patients are familiar with PRP, which is platelet-rich plasma. So in that process or in that treatment, we do a blood draw, and we place your blood draw in a centrifuge, which spins at a high rate, and we're able to separate your plasma from your blood, and we can use that as a topical for microneedling or perhaps to be injected for hair growth. But exosomes are sort of like, it's like PRP on steroids, much more powerful, a much more significant, highly more significant amount of growth factors that they contain that help to provide a better result. So the exosomes are sort of like messenger cells, and the message that they're relaying is to expedite healing after microneedling or laser or injections for hair growth, and they're also prompting the body to produce healthier, stronger skin cells. So the results we're seeing with exosomes are fantastic. It's always a plus, especially around the holidays, if you're getting a laser treatment or microneedling, to sort of push through that healing process a lot quicker. With microneedling, typically your downtime is about a day of redness, but it's less with exosomes. And with cool laser, you have a day of redness like you have a sunburn, but it's guaranteed to be around a day with the exosomes. They are fantastic and efficient and exciting.
And this is, I mean, exosomes are great too, and even for millennials, I know with COVID, either having COVID, going through COVID, anxiety, stress, a lot are having hair loss. I've had a lot of that coming into my practice. So, you know, hair thinning and changes, and the microneedling with exosomes has been fabulous. We're even seeing results within a month.
Absolutely.
We never saw that. PRP, it was better, but usually like at 3 months, and we're just seeing tons more hair happening sooner, and it's a lot less uncomfortable. I mean, microneedling with exosomes on the scalp or even the face is pretty easy. This is and I don't know, Gretchen, hon, if we bring this up to there, is that better? If we walk it up there? This is a before and after microneedling for acne, and that's even before we did exosomes, and now with exosomes, it's even better. So that's microneedling, and the nice thing about microneedling, do we talk about the downtime a little bit?
What's the time frame with this, Dr.?
Pardon?
The time frame, the before and after?
I think it's gotta be probably a month afterwards was her
It's really
follow-up.
impressive.
Yeah.
Even the older patient that came in today actually
Oh
had
my gosh.
microneedles last week. She came in and her skin texture was just noticeably smoother. And it was just 7 days later.
Yeah, noticeably smoother in a very short time frame. It's something that I was excited to share with the patient when I put her before and after photos together, but it's also something that she had noticed prior to coming in.
And I was injecting her and I just couldn't stop. I mean, it was just, I was like so close to her skin, and I've known her for forever. And I'm just like, oh my God, your skin, it's just smoother, it's softer, it's glowing. And this is in somebody, she's in her 70s, I believe.
Your skin is
So-
just like dewy looking.
Yeah.
A week
Beautiful.
after microneedling with exosomes, a week after. I mean, it's just insane to me. So, and that's the other thing, because we're seeing a month after with the hair growth and the skin. I'm floored by it. I actually think exosomes is the next new thing, and I don't think a lot of you have heard about it. It's fairly new in the aesthetic arena, and we're right on it.
We're leading the charge.
Is this kind of treatment good for any kind of skin, like sensitive skin or like any tone, like any color, skin tone? Is it?
Yeah, so that's the amazing thing about it.
Wow.
Whether somebody's skin type 1 or skin type like 6, or you know, they have dark skin or light skin, they have sensitive skin. There's been no allergic reactions with exosomes, which is more than you can say about a lot of things. So it's great for everybody and anybody. And obviously for me, so you know, you guys are young, but still there are some young patients who would benefit greatly from laser. And our cool laser by far is better than the microneedling. However, usually in young skin, you don't need anything that aggressive. But you know, I'm so impressed with what the microneedling and exosomes is doing. But if you have more sun damage and you have some lines or any scarring from acne, the Renew Cool Laser is good. And normally we would say Renew Cool Laser, a series of 3 is best, but in somebody you guys' age, 1 treatment is great. And the downtime with microneedling is super easy. You wake up the next morning, wash your face and throw makeup on and you're good to go. With the laser, you have about a day or 2 of redness, but again, you can put makeup on at 24 hours, so that's pretty good too. You will be a little bit rough for about a week, but nobody else can tell, and that's with laser. The microneedling, there's really, I could say almost, especially with the exosomes, no
Very
downtime.
You don't have like a slough.
Mm-mm.
No
Skin.
slough, no exfoliation, a slight redness, and that will start to very quickly wear away, especially with exosomes after the microneedling. You're good to go the next day.
Yeah,
Can I still do my skincare? Can I still put my sunscreen on like right after the treatment, or should I like wait some hours or?
immediately after, no.
Okay.
You know, we tell you let it be, even though the exosomes are really tiny nanoparticles, and they're in immediately. But I always like to just tell people let it be up until the next morning, just in case some of them are a little slow. But let it be till the next morning, and then the next morning get up and you can do everything, all your creams, everything, sunscreen. Retin-A, if you're on Retin-A or retinol, it's great to be off it for 5 days before, and then we usually say about a week after.
I have a question furthering off the acne question that you were talking about. I'm hearing a lot about microdosing of Botox, neuromodulators for acne. What are you doing? What are you seeing?
It's awesome. It is awesome. I've actually been doing it for a long time. I would just, you know, if I
off label.
yeah, exactly right. Yeah. So I go off label a lot. Well, I mean, we all do in the aesthetic world. You know, we're not going to wait and see. We're going to wait and see what it does with our patients, but I'm not going to wait for a study to come out about it, because by that time something else new is out. But what I found is, you know, I used to do it if somebody had bad cystic acne, and I might just dilute it a little bit and inject it in there. And what's neat about that is where I say regular Botox lasts 3 to 6 months. This actually lasts 6 to 12 months. So a lot of my patients would come back every 6 to 12 months to get it retreated. And it's especially great if you have like a certain area that you always break out in. We can go and do that. Now we're a little more advanced how we do it, because you really don't have to get deep. You know, you don't need to you could microneedle deeply with it, but you don't have to. We have like a tiny little container. We can dilute the Botox in there, and then it delivers it really high up into the tissue where you've got your pores, and it's really just relaxing the pore, like the muscle of the pore. So we put it high up in the tissue, and usually within 24 to 48 hours, that acne has calmed down immensely.
That's amazing. Do
Yeah.
you notice, like, you said it's relaxing the pore, does it make the pores look bigger, or?
No, smaller. The pores look smaller. So, I mean, that was something when I did, and I think my very first patient I did, she had bad cystic acne right here. So I said, well, you know, I kind of read a little bit about this, let's try it. So we did it there, and she came back in like, you know, I think a month or 2 months to see it, and her pores were just like almost non-existent there, and she was somebody that had huge big pores. So it was just really, you know, nice and small, beautiful skin.
I love that, it's great.
Yeah, and it's an easy thing to do. It's not painful, other than not washing it off for, you know, a few hours. There's really no downtime. It's easy and pretty quick results. You know, so if somebody comes in and they're getting Botox and they've got a big pimple, I'll sometimes just go boop and pop a little bit in there and say, okay, in 48 hours this will be gone for
You're
you.
welcome.
Yeah, exactly. You're welcome.
It's literally like magic.
It is. A lot of the things we do are magic,
Absolutely,
right?
that's the sound effects. Bloop is almost like a magic wand.
What else do you guys think about, worry about, wonder about?
I mean, all over Instagram, I'm being spammed with all these trends. What trends are you guys seeing? I'm seeing lip flip.
Lips.
Yeah,
Lip
lips
flip,
always huge.
jawline,
Yes.
a lot of fillers in this area,
Yes.
the lower face
And
for
glow
millennials.
The skin, like the perfect skin, like a very glowing, like smooth skin, you know, like
I'm seeing like a lot of like filler in chins now.
Oh,
I didn't know
yes.
chins were such a thing.
I know it's a big thing right now.
Uh-huh.
Maybe because it helped to make your face like look, I don't know, maybe like skinnier here.
More of those
I don't know.
nice golden proportions.
Yeah,
over there.
exactly. Like your jawline look better. I don't know why it's just such a thing right now.
Well, it's a lot about facial balancing. So I think in your generation, everybody wants to look perfect because you guys are raised with Instagram and
Filters.
filters and I will
Filters
tell you, on our Instagram, we have, I swear to God, I don't even know how to use a filter. That's why we don't use filters. So none of our pictures are filtered or touched up. They're all real. So that, if you look at it that way, they're even more incredible, because I think a lot of practices do that and we don't at all. Like I said, because I don't know how to, but so getting to a couple things. Lip flip is big. It's easy. It's 2 pokes, 1 here and here, boom. And what it does is relaxes the muscle, and then it makes your lip look a little bit bigger. It also helps prevent these barcode lines that people get when they purse their lips a lot. Some people are just pursers when they talk.
A lot of people with smokers' lines, I would actually say most, don't smoke. The lines form based on the way that they speak.
Yeah, so that's very preventative. You know, when we see people who are pursers when I talk, you know, we usually recommend that they do that. So the lip flip does both of those, and it's a nice way. You know, when a lot of the younger patients started coming in for lips, and I thought, oh, maybe they're a little too young, they're 18, I would do a lip flip and, you know, say, start here, see how it looks, but inevitably they were all gonna get fillers anyway, which it speaks to something else, because I do think it's very trendy right now to get fillers, but what do you guys think about the lips? Like, what do you think about big lips versus small lips versus?
I
What
like
do
the
you
lip
think?
flip because it's
Yeah.
not so permanent. It gives you a chance to kind of test out like what you would think like
Yes.
maybe you want with fillers. It's not going to give you any more volume, like you said. It is just going to flip it, but it's a nice way to try it out. I like it. I think it's no, it's not permanent. It is a nice effect. As far as the prevention of the upper lip lines, or what do you call them, barcode lines?
Barcode.
I always call them like straw lips, like you've been drinking out of a straw, but I just smoke their lips too.
Yeah.
So that's great that you've got that benefit as well. You do the lip flip, it's just the top lip, do you do top and bottom?
Depends
Where
on
are
the
you doing?
patient. Yeah, if they have a smaller bottom lip, I'll do both. If they're pursing upper and lower, I'll do both. So it just depends.
And can it give them that ducky look?
Never. They can't look overdone. They can't look ducky. I mean, it's a great way to start. And some patients need it as well when they do fillers. So sometimes we combine it. But I think it's great. I usually love to recommend that, but like I said, a lot of people, like, they're just gonna go for the filler. But
And
it's a
price
great way to
wise,
start.
I
Oh my
mean,
God.
it's way cheaper than getting your lips
Yeah.
filled.
Way
Yeah.
Big
cheaper.
time.
It costs, what does it cost about? Cause I use anywhere from like 4 to 10 units. So 10 units is like $150.
Yeah, it's
So
very affordable in comparison, absolutely, and it wears off pretty quickly, and it's like a good introductory
Yes,
Yeah.
and it's
to
safe.
exploring this area with
More
injectables.
more natural, so you don't even like see like a huge like difference.
Like
you
your
know?
lips don't enter the room before you
Exactly.
do.
Yeah,
Sorry
exactly.
to hear that.
It's never good. Never
Yeah, so you know, I think that's a really great place to start, and I think it's a great idea. Jaw lines and lower face and chins, all about facial balancing. So, you know, if people are gonna get lifted or get cheeks, I'm not a big fan of huge cheeks on somebody, you know, for your age, just because I feel like it makes people look older.
It does.
Like
Yes.
I think it makes like 20-year-olds look 40.
I mean,
Why do you want to look 40 when you're
like
20?
Santa.
Yeah.
Right?
Like
Like those
Santa.
big
Yeah.
Big jolly
We're in the
cheeks.
season, so yeah, like the big lips
Yeah.
stuck on, like rosy cheeks. That's very Santa to me. I don't want to look
Yeah.
And
like
I
Santa's
think,
great. I don't want to look like him.
and I think that has to do with like filler technique. It's not filler, it's filler technique. So, you know, you can do things in a very natural way depending on what you could take the same product and somebody else can take that product. They can put it here and you're gonna look cheeky and unnatural and older, where I could put it here and you're just gonna look lifted and beautiful and contoured. So down in the jawline, if somebody turns to their profile and their chin is in and their nose is out and their lips are out, then we need to augment their chin to balance. So it's all about facial balancing. It's about trying to get back to that heart-shaped face, or to get it if you never had it. So I think that's why these things are in. And they're easy to do with like Radius or Versa or, you know, other fillers.
It's like I always see like people are talking about that, you know, everyone wants that nice, was it Gigi Hadid?
Yeah, like a
That
chiseled
great, that
jaw.
great
Yeah,
jawline.
like real
How do you
lines,
keep
yeah.
that from becoming, like at some point it crosses over into like looking masculine? How do you balance that? And like, is there a proportion that you're looking for, like with cheeks or like the length of the face, or how are you?
And you completely, I mean, it's, you know, it's all about balancing. So you do want to be wider in your mid face and narrower down here. So you know, to create that very sculpted jawline, not everyone can get it. Filler is not always the only way. We have machines too, like alt therapy, that can contour.
We need to talk about that later.
Yeah, and alt therapy, you know, is great when you're younger because alt therapy is going to stimulate collagen. And who's going to stimulate collagen better, you guys or me? You guys, right?
Yeah.
So it's great to get on alt therapy. Alt therapy is focused ultrasound, non-invasive, no downtime, and it's a single treatment that lasts 2 to 3 years. Kind of a no-brainer.
No brainer.
Safe for any skin type, and it's wonderful.
Results are fast?
Gonna
Is it
give- no.
time?
Takes like 1 to 6 months to get your results.
But
So
it
if
lasts
you're-
3 years.
Yeah, if you're not in a rush, it's great. You know, it's a great way to do it, and it's, you know, you're not gonna look unnatural. And I call it the fat pad relocation project. You know, so it's we can actually visualize where your tissue is. And Ashley is one of our, you know, she's one of our alt therapists, and visualize it and put the energy there.
It's tailored to each patient specifically. So as I'm treating a patient, I'm watching an ultrasound machine and I'm mapping for their SMAS, which connects the muscle with the tissue, and that's my target. So that's where I'm aiming to send the energy that's going to lift and tighten. And we call it our heavy lifting machine because that's what it does.
Yeah.
With
And
no downtime.
It's great. So it's basically, I think at a month, and especially in a younger patient, you can already see changes.
You're
And
not
they
gonna be
can see
like
changes.
lumpy, like some kind of like weird lipo neck thing. People are doing it, I see it.
Yeah, no, you're gonna lift, it's gonna put your fat pads up, you know, where they should be or used to be, or lift them to, you know, in my case, it's where they used to be. In your case, it's just up a little higher from where they are. So it almost makes you look like you had filler.
Absolutely.
it does.
And it produces more than a generous amount of collagen. It prompts you to produce a significant amount of collagen. I was completing an advanced oil therapy training actually this week, and I was scanning Dr. Barrett's face, and her collagen levels are off the charts because she's previously done oil therapy.
Yeah, there's a ton of it in there. So, you know, and that's the great thing, and it speaks for the machine. You know, the trainers said you can always look at somebody's face and see that they've had all therapy because their collagen is pretty dense, and it's really amazing. So that's another great thing that, you know, preventative could be done. Yeah. So what else?
I also heard you mention earlier to a patient, for fat reduction, it's not Kybella, it's
Oh, DCA.
DCA.
Yeah, deoxycholic acid. It's really the same thing as Kybella.
Okay.
So if somebody genetically has a lot of fat under their chin, we can inject that and it's gonna melt that fat permanently. So it immediately melts that fat, but you do get a little swelling with it for up to 2 weeks. It's usually gonna be about 50% more swollen than it was before. And it's a great way to chisel that jawline as well. Yeah. And that's an ageless thing.
Everywhere?
Yeah, you
You can use
can,
it
you can. You can use it for bra fat, back
Okay,
fat, belly fat. It can be used anywhere. It's a great alternative to liposuction. Usually we do that in 2 sessions, that you do it 8 weeks apart, and some people need a third, but most people are good with 2.
How long usually does it last?
It's permanent.
It's
Yeah,
permanent.
once those fat cells are gone, they're gone. Cause you're only born with a certain number of fat cells. So once we've got
How
them
many?
gone.
How many are we taking through here?
What's the count?
One injection kills how many fat cells?
So even if you like gain weight or losing weight, even if you like, wow, that's impressive.
And I guess done some young people with
Yeah.
that, like 18-year-olds that they just genetically have a lot of,
Yeah.
you know, a full neck, and they've
Mhm.
lost, they've never had a jawline. So that's one way to get your jawline back.
Absolutely.
I like that as opposed to immediately going for the filler. Like,
Mhm.
Yes.
it's a nice.
Yeah, there's definitely, you know, that you said the word immediate though, cause
Yes.
you know, usually when people come in my office, they want something that's gonna give them immediate
Well, I
change.
want immediate.
Right, it's immediate, so filler is always gonna be the immediate, but yeah, the machines are things that, once you have your immediate and you've been treated, then you can go on and have the machines, so that next time you don't maybe need as much filler, or your filler's gonna last longer. So, what else, guys, anything else?
I think we covered a lot of bases, and
We
I'm
did.
so
We
glad
covered a
that
lot.
we talked about what we can do with machines in addition to what we can do with injectables.
Yeah.
Preventative measures,
Yeah.
that type of thing.
And it's all, you know, I mean, it's very rare that somebody comes in and what concerns them
Mm-hmm.
is just one thing. You know, we've learned from years that this combination therapy is the best therapy. And that includes skincare and the machines and the injectables, the lasers, you know, it's just everything together. So, best results and natural results.
Yeah.
Always.
Is the key.
The good thing is like that the only thing is like that most people think that like medical aesthetics, like filler products are like, they make you look fake. But it depends how you're using that, depends like who does this kind of treatments on you. And most of the time can even like help your skin, like if you have like, I don't know, like stretch marks, or you can have like acne, or like any different kind of skin problem that you can have, you can prevent anything that you can have, just need to find like the right treatments for you. But the things that most people don't know this, because they still have like these old stereotypes, you know,
Mm-hmm.
and they think that all this is just fake, and they don't, you know, they just maybe they see someone had just got a lip filler, and maybe the lips are like super like big in that moment, you know,
Unnatural.
super unnatural, and maybe that person didn't even go in the right person, you know. So
That's an excellent point. I definitely think that there's, like you mentioned earlier, you know, it depends on the skill level of your injector. You know, you're putting something, especially with filler, if you're putting something in your face, it's gonna last, it's gonna be there for, you know, 6 months, a year, or so forth. That's a long time to be unhappy with something.
Absolutely.
So we've got, you know, our amazing expert, Dr. Barrett, over here. So, you know, it's like you can't go wrong there, but it depends, you know, you need to make sure that you're going to the right person, someone who is an expert, and not just someone who
Just started last week.
Or post nice pictures, as we mentioned.
Right.
Sometimes they're
Yes.
edited, and it can almost be like an interview process for the patient when you're meeting with the doctor that you'll be working with. I think it's important to ask questions and to take your time and to get to understand the treatment that you're doing, and that's why we schedule consultations and we take our time and answer patient questions and ensure that they understand what their options are, all of them.
And I think listening to the person, you know, making sure that you understand what they want, what bugs them. Mirror, mirror, mirror.
Yeah.
You know, that's the first thing we hand the patient. There's at least 1 or 2 mirrors in every room. Look here and let me know what bugs you. And, you know, then you go from there.
giving a realistic expectation.
That's huge. That's
What-
huge.
What that client may think is something that they want or they can achieve with one treatment may not be possible at all, or may require several treatments.
Right. Or they don't need as much as they thought.
Exactly.
Sometimes that happens, you know. Or maybe that's what's bugging them is actually it's a different reason. So it's all important. And that's why we do these. It's all educational. We want you all to learn. We want you to be educated, whether you come to us or go somewhere else. It's all important that you understand what you're doing, why you're doing it, how you're doing it, and it's good. Thank you guys. Han, do we have, yeah.
We're being cut off.
He says, we've gotta go. All right, well, thank you all for tuning in, and we will see you next month with
See you
another
next
great
month.
See you
topic.
next month.
Bye.
Bye.
Bye.